our senators here. So I am Senator Karin Housley, and this is the Aging and Long-Term Care Committee on Wednesday, January 13th. Thank you, everybody, for coming. The reason for today's meeting is, I'm sure, like many of you members have gotten hundreds of emails, phone calls, text messages, Facebook messages. I had another call yet again this morning from my friend up north about the vaccine rollout and how can we get the vaccines to those who want it that are 65 and older. It's been frustrating for many that they aren't able to get any answers. There isn't a list that they can get on. There's not a phone number that they can call. So they've kind of just been running on this hamster wheel, and they just want answers. And I figured, since we heard last week that there were 4,800 Minnesotans that had actually given written testimony to the Vaccine Advisory Board, I thought we'd give them a platform for us to hear from real Minnesotans on what their concerns were with the vaccine rollout and how they feel it should be going. So again, I have stacks of letters that I've printed out, but instead I thought we'd just give real Minnesotans an opportunity to give us their story and for us to ask questions. We're going to start out with Senator Dr. Scott Jensen, who thank you so much for taking time out of your busy day from your office to give us an update on the vaccine and what your thoughts are coming from the medical world on how we're doing here in Minnesota. So with that, I will turn it over to Dr. Senator Scott Jensen. Welcome to the committee, Dr. Jensen.
Thank you, Madam Chair. I appreciate it very much. And I also want to thank you for holding the meeting. I think it is really important. We're at one of those critical moments during this vaccination rollout, and we want to make certain that people know that their concerns are being attended to. My name is Dr. Scott Jensen, and I do talk to patients literally almost every hour regarding the COVID-19 vaccine. And perhaps I have 3 or 4 points that might summarize the feelings of many Minnesotans. First off, Minnesotans are on board with the Department of Health's plan in regards to the tiering. The frontline workers coming in contact with COVID-19 are the highest priority. Next, we certainly want to focus on long-term care facility residents and staff. But once we're moving through those two groups of people, we want to really focus our efforts on the vulnerable. And if we want to go 75 and above for a period of time, and then move 65 to 75, that's a reasonable plan. But the most important thing is that we not squander doses, that we not have them perish because they were not able to be stored adequately. And certainly there are a variety of requirements depending upon which dose or which vaccine we're talking about. Pfizer and Moderna both require 2 doses. Having said that, I think that if the Department of Health could do 2 or 3 things, because they certainly have access to a lot of media, if they could, one, get a single phone number available and put it in your news conferences. Have the Minneapolis Star-Tribune put it out there. Have radio stations put it out there. But let people know where they should call. There's a tremendous amount of confusion because they're calling the State Department of Health or their county public health departments and being told to call the clinics. And the clinics are telling them to call the departments of health. Many clinics are not able to take the vaccine because of storage requirements. Some pharmacies are providing the vaccine, some are not. But there needs to be some clearinghouse phone number available so people know what to do. The second thing is, people need to realize that vulnerability doesn't just focus on age. If you're not 65, but you're 63 and you have diabetes, congestive heart failure, and you had a valve replacement a month ago and you're on chemotherapy for breast cancer, you need to let your doctor know that. We need to let the Department of Health know that. But again, I can't say it strongly enough. We need to make certain that there's a phone number, a way for people to either sign up or find out what they can do because they're absolutely confused. I think that the rollout programs that we've used in the past for influenza could have value here. I know that there was a real emphasis on trying to make sure that we followed the guidelines, but now we're finding out that we've got hundreds of thousands of doses around our country that are sitting in refrigerators or freezers, I should say, and not being administered. So I know the Department of Health is working on it. I know that's critical. I also think there's perhaps two other things that you may not be aware of that you might want to be. One is in the studies, in the trials with Moderna and Pfizer, I do not believe there were any studies done specifically on patients over the age of 85. When they were doing their trials, the age block they were focusing on in the vulnerable group was 65 to 85. So again, I say that not to frighten people, but to simply let people know that these are at some level highly unusual times. They're experimental in nature in regards to the fact that we haven't had the full breadth of time that we might normally have to roll out a vaccine. We did it in less than 12 months when the normal time would be 3 to 4 years. So I think it's important to realize that we will be watching carefully to see what kinds of reactions we get. And I think the second thing is, and this is a concern of mine, and I don't mean to be Debbie Downer, but when the original trials were investigated and the data was examined, Moderna, Pfizer, and the FDA looked this data over and said, okay, based on what we're seeing, it might be best to avoid vaccinating kids under the age of 16 to 18, pregnant moms, women of childbearing years not on contraception, and people who have confirmed previous COVID-19 disease, either through a PCR or a serology test. Now, remarkably enough, when the vaccine actually got rolled out, the CDC and the FDA came out, and the only real restriction they put in place was kids. For that reason, we have seen some moms be vaccinated that are pregnant. I think we had something like 500 some pregnant women that did receive the vaccine. We have numerous women who are not on contraception, sexually active, not pregnant, but potentially at risk for becoming pregnant, and they might have mRNA vaccine in their system, and we don't know what that does. And we also are seeing people with previous COVID-19 and continuing evidence of immunity in the form of IgG antibodies receiving the vaccine. Now, again, I'm not going to make a big stink about this, but this is a precious commodity, and we don't have enough to go around. And so I would have to ask the question, is this what we want to do? And if it is, if the Department of Health says this is what we want to do, then declare it. I think we should declare it so that people know that the initial conversations, there were going to be several groups exempted. And now the only group that's really been exempted at this point in time is the 16 to 18-year-olds. And I do, as a physician, taking care of all of the kinds of people I just referred to, I do have some discomfort with it. With that, Madam Chair, I'll conclude my remarks. And if you'd like me to stand for a question or two, I'd be glad to. Thank you for letting me speak.
Thank you so much, Senator Dr. Scott Jensen. I too have expressed my frustration with the lack of a place to go. I think that's what that Minnesotans want. Just please let me get on a list somewhere, even if they set up a website that you could go to put your name and your phone number and your email address, so you know you're on that list and you are in the queue somewhere. Because right now, everybody, like you said, they're calling their clinics, and their clinics don't know what to tell them or where to direct them to. Members, does anybody have any questions for Senator Dr. Scott Jensen? All right, seeing none. Thank you so much. Enjoy the rest of your day. Love your background. It's morning, but thank you so much for joining us, Dr. Jensen. That was very informative. Thank you.
Thank you.
I want to let the record show that we do have a quorum present. I got muted. So we do have a quorum present. Let the record show that. And now we will go into public testimony. We have a list of people that would like to testify, and I want to thank you for getting up early and joining the Zoom. I know for some of you this was a little foreign to you to get on and do it, the committee this way, but this is where we're at. First up, we've got Joyce Lindgren to tell us her story, and I think I think you're going to turn your camera on. I'm not positive, but I think Joyce or your daughter Kirsten, if you could. There we go. Yay. So just state your name for the record and then go ahead and proceed. Thanks for coming, Joyce.
Thank you. Good morning, Madam Chairperson and members of the committee. My name is Joyce Lindgren. I'm retired and I live in Stillwater. And I thank you for this opportunity to speak with you. I'm a 73-year-old plus senior. In a few months, I'll be 74, and I have several underlying conditions, including I'm a cancer survivor, a 30-year history of diabetes, high blood pressure, and anemia. My husband, sister, and I have also been isolating since March of last year, and because of COVID. And we all feel that if we get COVID, we will probably die because of our conditions and our ages. Since March 1st, I haven't been able to go to the gym, so I feel like I'm not getting the exercise to keep my conditions up. I haven't been able to go out to dinner, shop in stores, and visit with my family and friends and other members. I have had only one virtual medical appointment, and that was last April. They weren't taking any in-person visits, and I didn't feel that I got much out of that because they didn't have any access to my labs. I've had to postpone all my dental appointments, and by had to, I mean it was my choice, and had to cancel several doctor's appointments, graduations, birthdays, and holidays. I've ordered all of my groceries online and picked up prescriptions and any other things that I need curbside. I'm sure we've all had to do this, but when you're my age and you don't know how many years you have left, it's really hard to put your life on hold for a whole year or maybe more. In December, I lost two very close relatives and a good friend to COVID. They were in nursing homes and I couldn't visit them and I couldn't attend their funerals. We've had great hopes with the vaccine, and according to the news, the first tier should be administered by the end of January. I spoke with my endocrinologist last week at the University of Minnesota and asked what the policy is for administering the next round of vaccines, since all of my doctors are on the staff there. And she said she doesn't know of any policy or procedure. And I cannot believe that the state and one of the largest medical facilities in the state has not been planning for vaccinating the next groups. I've also asked my pharmacist this week when I picked up my prescriptions, and they said they haven't heard of anything either. And my pharmacy is one that's been giving out my flu shots and all my other vaccines. Plans should already be in place. And as we've already discussed, people don't know what the plans are, but it's really disheartening to find out that medical treatment facilities don't know either. And I want to know what the procedures will be. And I just heard Dr. Jensen say that, our clinics will put us on a list and we'll be notified. Well, if they don't know of a list already, how are they going to do that? Am I going to have to sleep in my car overnight as they've done in Florida, only to get up there and find out they've run out of the vaccines? And do I need to get on this phone line you're talking about and call hundreds of times only to be hung up on or say it's not in order? Last night, the NBC Nightly News report said that the federal government is now suggesting that seniors over 65 and people with underlying conditions should be vaccinated in the next group. MDH just reported this morning on the news that they're waiting to see how many vaccines they get before they change this procedure they've already discussed. And I'm wondering, instead of a mass herd of people, maybe we need to go to some lottery system by birth date or whatever. I'm not saying I should be the next in line, but I would like to know when I get in line and not have to be so frustrated as I've been for the last year. I've seen on the news that in Florida, 10% of the people already vaccinated are not from Florida. They're snowbirds from other northern states and from Canada coming down and getting the vaccine there. That means Florida's losing vaccine, and other states that had it allotted have more than their share then. Some seniors over 60 are already getting vaccinated in some states. I understand from the news too that the plans for administering the vaccine are up to the states. And I would hope that Minnesota would understand the needs of the elderly and protect those who are most vulnerable. How many seniors are going to die waiting in line for their COVID vaccine? I was lucky enough to survive cancer, and I don't want to die from COVID because I have to wait in a line behind younger, more healthy individuals. I hope this committee will have an influence on Minnesota's vaccination policy and that you will advocate for seniors. Thank you.
Thank you, Ms. Lindgren. I'm so sorry about your friends. That is hard. That is hard, being cooped up for almost a year and not be able to attend any friends' funerals or see friends or family. It is very, very difficult. So with the vaccine on the horizon, it would be nice to know where you are in line, at least just knowing, even if they tell you that it's going to be February 5th, so be it. You know you have your date. And
Absolutely.
Yep, I completely agree. Thank you so much for your testimony.
Thank you.
You're welcome. I think we'll just keep moving on. And if members have any questions for any of the testifiers, just raise your hand in the on the screen. Next up, we've got Jillian Hendrickson. If you can turn your camera on, Ms. Hendrickson. And then after Ms. Hendrickson, we will go to Ms. Schneider. So we will wait for Jillian here for a second. There she is. Hello, Jillian. Go ahead.
Good morning.
State your name and tell me where you're from also.
So my name is Jillian Hendrickson. I am from Albertville, Minnesota. I am an elected official in Albertville and am very privileged to speak with you, Madam Chair, and committee. So I am lucky enough to share with you that I have 4 living grandparents. And I am also, I would say, probably more savvy than most when it comes to the situation with getting access to the plan because of the fact that I am an elected official. I also work in the healthcare industry. So with that being said, I shared with Senator probably 2 weeks ago and my senator that I have a 94-year-old living grandfather who's a veteran, and he is caring for his wife who has middle of the road dementia symptoms. And then my other grandparents, my grandfather is also caring for my grandma who also has dementia. So this has been a hard year for a lot of people. And that being said, you know, I feel like my role as a granddaughter to fight for them and to help them understand when it is time for them to go get a vaccine. You know, each of them have 5 children. They have been quarantined just as much as the previous woman had shared. It's been really difficult. So we don't need to tell anyone that, but I can tell you that after probably 3 weeks of working with the VA system, they just recently decided to start vaccinating 85 and older. It took probably 4 or 5 phone calls just this Monday to finagle a way to figure out if they're going to be vaccinating 85 and older. So that being said, you know, I just want to make it clear that most people don't have an advocate like myself. And it's very confusing, as Dr. Jensen shared, to these people how to get scheduled. We got my grandfather scheduled on Tuesday for his vaccine for Thursday. And it's also very confusing to him why he gets it and his wife cannot. This being said, you know, being in the healthcare industry, I am also very close with several people that are frontline workers, and they've shared with me their frustrations with the hospital systems having a policy of non-discriminatory vaccination. And what that means, which you may be aware, is that anyone can be vaccinated that works for the hospital system, which would be a lunch, you know, a cook, a mechanic, or for example, my mother-in-law, who is a St. Cloud Central Care Hospital volunteer. She is not allowed patient interaction yet at this time, but she was able to get her vaccine. And as much as I think she deserves a vaccine, as much do many people, it is not an essential situation where a hospital volunteer needs to get a vaccine. When I have listened to constituents in my city and my own grandparents, struggle to handle the holidays and not see people. So it's disappointing, as Dr. Jensen said, for me, being someone who usually tells people it's online. Like there's always a forum for you to go and speak. There's always somewhere to go to find out that the governor had put together a committee of people, but then it says right on the state's website that it's not public. So we can't listen. So I went and read the minutes of the December 30th meeting, and they spent considerable amount of time on prisoner vaccination, a considerable amount of time on vaccinations for different race, and all of those things are important, but they didn't spend quite a bit of time on how we're going to vaccinate our seniors. It was brought up, but the most important thing, I think, is the death rate and the death age, the ages, and what you can see in statistics. We keep talking about science, but if we're talking about saving lives and healthcare professionals' role to save lives, it's really important that they put a good plan together to roll this out. So, I have made it my number one priority in my family right now, because I watched my grandparents grieve the loss of their daughter, my mom, who died in September. And I haven't been able to, I only got to see them at the zoo, since. So the fact that there's a vaccine out is fantastic, but I want to see the governor's team be more transparent about where we're going to go, because I've also heard of other seniors being told by their clinics they're going to be able to get it in January. And I just don't know if that's possible at this point, how they're going to roll it out if people are being told there's no plan. So whatever this committee can do to try to communicate that, I'm 100% behind you. So thank you.
Thank you, Ms. Hendrickson. I'm so sorry about the loss of your mother, and thank you for being an advocate for all of your grandparents. It's a lot of work, and it's heartbreaking, and I'm sure they want to advocate for themselves, but in these times it's just really, really difficult, especially with technology and being of that age. What was the reason that they told your grandfather he can get it on Thursday, but what was their reason to say that your grandmother living in the same household can't go with them to get it?
She's not a veteran.
Oh.
Because I figured out that he could go through the veteran system, and they're allowing veterans 85 and older at this point to be vaccinated. So, which is, thank goodness that the veteran system is giving out vaccines at this point to seniors, and they have that ability to do that. But what's scary is that the veterans wouldn't know that, because, he was never called. And it was only because I am kind of a bulldog and worked through it to find that out. So, he made it a comment. He called me. We went out actually for dinner on Monday to a local restaurant, and he called me to thank me, which was really sweet. And he said, "Let me know when the women can get it."
Oh. Oh, sad.
So it's I know it is. It's a really important time, and I know, like your committee too, with in the future, I had an opportunity to meet Senator Putnam yesterday on transportation needs, and I think this committee is, it's a big job, so I really hope that the governor takes your recommendations seriously. So.
Thank you so much, Ms. Hendrickson. Yep. And you're right. It is, and it says it on Minnesota Department of Health's website, and they say it in all of their calls, that it is ultimately the governor's decision on what this rollout is and has been and is going to be. So hopefully he'll take all of our public testimony into account when they decide what the next steps will be. And as quickly as we can get those 65 and older, and it's hard when you break them out. If you have an 85-year-old veteran getting it ahead of his 84-year-old wife, doesn't make sense. We need to get all of these people vaccinated as a top priority. Thank you, members. Any questions for Ms. Hendrickson? Thank you. Next up, we've got Ms. Schneider, and after her, it'll be Deb Kevaney. So Ms. Schneider, if you can turn your screen on, there you are. State your name and what city you're in.
Sure. Well, good morning to you all, and thank you for allowing me to be here today. My name is Dawn Schneider, and I live in Pipestone, which is down in southwest Minnesota. I am here this morning on behalf of my mother, Gladys Taubert, who lives about 8 miles from me in a small town named Holland. My mom is 89. She'll be turning 90 at the beginning of April. She lives alone in her own home where she has lived for over 50 years. She's comfortable there, and she's able to take care of herself quite well. She walks 2 miles a day on her treadmill and spends her days quilting and reading, and she can clean circles around me. She's amazing. She really is. But since last March 14th, my mom has rarely left her home, and she's so very, very lonely. I'm retired, and I don't see other people, so I'm clean. So I go to visit her once a month or so, but I had COVID over the holidays, and now she's even scared to death to see me. Every single holiday this year, she was all alone. She wants to be vaccinated, so she called our local doctor's office in Pipestone, and the clinic told her they weren't sure when she would be in line for a vaccine, but that she should watch our local weekly newspaper and listen to our local radio station to find out when the vaccine would be available to her. My nephew, who's her grandson, is getting married on March 13th, and she really, really wants to go to the wedding because she hasn't really been out of the house in a year. But she will not go if she hasn't received the vaccine. This is just one of the many ways in which her world has been upside down since COVID started. In other states, elderly individuals can sign up to make an appointment online to receive a vaccine. Since I live in southwest Minnesota, we live very close to South Dakota, just a couple miles from my house. And the elderly there can receive their vaccines now. So why isn't Minnesota up to speed with what other states are doing? And why is it so hard to get any information about where and when my mom can be vaccinated? So my final question for you is this. Is it more important for the staff at our local optometrist's office to be vaccinated, because they were, than for people like my mom, for the elderly, many of whom have been stuck at home for nearly a year? I sure wish the process of vaccinating elderly and high-risk populations was moving a little faster for those people like my mom. They're not feeble enough to be in a nursing home, but they're old enough to be greatly impacted by the virus. Thank you very much for hearing my concerns.
Thank you so much, Ms. Schneider. It's good to see you. And that too is one of the concerns that many of us have been hearing is those people that are aging gracefully in their home. Where are they on the list? We know that they're doing nursing homes, and then they're going to do assisted living, memory care, independent living. But where in that, just because they're 65 and older living in their home and not in a facility, they should still have equal access to the vaccine. And that's something that would be nice for them to know. And like you said, it's pretty difficult to keep checking your local newspaper or your radio station to see when can you get the vaccine, when it would just be better to have a one-stop shop and be able to know when am I on that list. So
Yes.
I'm glad you made it through the COVID. I'm glad you're here.
It wasn't too bad for me.
Yeah, that's good. Good. Thanks so much, Ms. Schneider. Thank you.
You bet. Thanks for having me.
You're welcome. Next up, we've got Deborah. And Deborah, I'm sorry if I'm not saying your last name. Is it Kevaney?
It is Kevaney.
Oh, yes. Deborah Kevaney. Thanks so much. State your name and where you're from.
Thank you so much for the opportunity to speak, Madam Chair. My name is Deborah Kevaney. I have a drugstore, a local community drugstore in Winstead, Minnesota, so about 50 miles west of Minneapolis. And we would really like to vaccinate as many seniors as we possibly can. We're just not really given the opportunity to do so. I heard on the news this morning that less than 35% of the doses that have been dispersed have actually been utilized. And to me, that is a tragedy. States like West Virginia didn't go along with the using the 2 chains to be able to roll the vaccine out, and they are 100% complete with phase 1. I think if Minnesota Department of Health and even the Minnesota Board of Pharmacy would understand the value that community pharmacists bring to the communities and how quickly we could get the vaccine out, Minnesota would be in much better in a different place right now. Many community pharmacies like mine actually do flu vaccine clinics when it's flu season. So we will take a pharmacist and the flu vaccine into an assisted living facility. We'll take it into a nursing home. We've set up clinics at different local businesses. We've done flu clinics in the basement of churches. We've done clinics at City Hall. So community pharmacists are where the people are who need the vaccine. And we are nimble enough to be able to understand that if you can't come to us, most of the time we can come to you. So if we could have access to this vaccine, I think you would see a great number of seniors and vulnerable patients get this vaccine much quicker and much more efficient. If there's anything I can answer for you, I mean, community pharmacies really do this every day, all day long with the flu vaccines, tetanus, Shingrix. We're ready to go. Many of us, I would say most of us, have gone through the training modules through CDC. We've gone through the training modules of Minnesota Department of Health. We've got freezers. We've got everything that we need except the vaccine. So I guess my question would be to Governor Walz is, you've got a lot of pharmacists here that are ready and willing to help. We are spread throughout the state in small communities. Instead of signing an executive order to allow out-of-state pharmacists in, how about we look within the state of Minnesota where we already are living in our communities, taking care of our seniors and other patients in our communities, and utilize us. We're here now, and we want to be part of the solution.
Thank you, Ms. Kevaney. Members, do you have any questions? Senator Curran.
Hey, Madam Chair. Speaking of the rural pharmacies, because I mean, it is going to be very impactful, and we appreciate the testifier. We need to know. I think we've all had many updates from MDH and about the vaccination rollout. I don't recall, where is that significant expansion into the independent pharmacists throughout the state who have the capability? And I'm assuming they all have a registry of your storage capacities or the ability to support either one vaccination or the other, or all of your capabilities as an independent. Does that list exist? And if not, we've got to make sure that we push MDH strongly to get that out there as soon as possible. So I would love your feedback from the testifier to know, do they already have those things, and why are you being treated differently for this particular vaccination in the rollout than all others?
Thank you, Senator Kevaney.
I'm sorry, Madam Chair. I think MDH already has this information because all of us were required to fill out a survey initially indicating that we had completed training modules, that we have a freezer that is within the guidelines, that we're able to track the temperature to make sure that there's no deviations in the temperature outside of the guidelines. And then we've also had to sign a contract with MDH, which was both a Part A and a Part B, discussing the same thing. So I think many independent local community pharmacies have filled out the initial survey for MDH, and most have already signed both statement A and B with them. We're just in a holding pattern waiting.
Thank you. Right, and in greater Minnesota, our independent pharmacies is how you connect with the community, and they don't necessarily have the Walgreens or the CVSs have the vaccine. It's the small independents. So interesting that I didn't know that you guys had already filled out the paperwork and you're ready to go. You're just not getting any communication back.
That is correct.
Thank you. I didn't know that. Seeing no other question. Oh, Senator Hoffman.
Thank you, Madam Chair. And it's interesting about that in Winstead, St. Mary's. There's a assisted living and a nursing home and some other places within Winstead that, to hear Deborah talk about, they don't even have a plan. It's like, well, then how is that going to be rolled out through that definite assisted living and nursing care facility? St. Mary's, I believe, is what it's called. And that kind of brings the question back to what Senator Mark Curran was saying. What's the plan for that, right? And instead of us bothering MDH all the time, it would be good, going back to Dr. Jensen's point, why don't you just isolate and set up a plan that's in place so everybody can kind of see that blueprint or a one-stop shop so that we're not having this conversation in the near future.
Thank you, Senator Hoffman. I agree. I still am struggling with why is it not those at the highest risk of losing their lives aren't the first ones at the top of the priority list to get the vaccine? That to me makes the most sense. Like somebody said, they're already getting the vaccine at the local optometrist, yet you've got 84-year-old people living in their home not able to get it and not knowing where they are on the list. It just doesn't make sense, especially after they've been isolated for so long, and that's their ticket to get out and get to family members' weddings. So it is very frustrating, and not having a plan yet, and still 10 months into this, and we don't know. Thank you, Ms. Keaveney. Mr. Hoffman, Senator Hoffman.
Thank you, Madam Chair. And I guess, Ms. Keaveney, the question to you is, have you been in conversation with St. Mary's folks about this kind of lack of communication or trying to get a local plan put in place?
Ms. Keaveney.
Thank you, Madam Chair. We have not been in touch with St. Mary's directly. We were told we needed to go through the county public health departments. I have contacted both the McLeod County Public Health Department as well as the Wright County, since I'm close to Wright County. Wright County did set us up to do immunizations for Brookridge and Edgewood Gables, an assisted living area there. McLeod County has sent me a couple of emails where they're trying to coordinate and figure it out for inside McLeod County, not only in Winstead, but a few other facilities. It just seems like no one really has a plan, and everybody is struggling to try to do the right thing. So hopefully we'll be able to help folks in Winstead when McLeod County is able to get us in the pipeline.
Thank you. Any follow-up, Senator Hoffman?
No, Madam Chair, that just speaks to the fragmented approach that we're all experiencing and why we're having this conversation. There's also they're less than 100 feet from Carver County as well. Winstead kind of sits in that little pocket. So I would see there's a triadic county fragmentism that is occurring. So thank you, Deborah.
Thank you, Senator Hoffman. Thank you, Ms. Keaveney, for your testimony. That was informative. Next up, we have Lisa Papp Richards, and after her, it'll be Barbara Heenan. Ms. Richards, if you can turn your screen on, state your name and where you're from. I think she's getting it on.
Are you there?
Yep, there we go. There's Lisa Papp Richards. State your name and where you're living.
Okay, Lisa Papp Richards. I'm from Bemidji. And so my mom was in the hospital when they got the shot at her facility. When my mom went back to her facility, she was not allowed to have the shot. And they told her that she could not have her shot until they came back for the second dose, which would be in February. I don't understand why. I've offered to take my mom to the doctor to get the shot. Nobody will give me the answer for that. I have a problem with only the nursing home getting the shot because we have assisted living there. We have memory care there. We have staff that goes throughout the building. And so if you're going to give it to one, I feel you should give it to all of them. I really feel that the Minnesota Department of Health is playing games with our loved ones' lives. I don't know how much time my mom is going to have left that I'm going to be able to spend with her. And I would like to have her to have the shot. The shot is very important to my mom. We just had this conversation last night. She wants the shot. She wants the shot so that she can see me. I'm an only child, and it's important. And that's really all I wanted to say is just, keep up your good work. We appreciate everything that you have done for our elders. We probably would have lost a lot more elders if it hadn't been for your hard work, Senator Housley. And keep going. Just keep going. Keep at these people. And thank you.
Thank you, Ms. Pap Richards. I think that too is something I've heard from a ton of people, both the healthcare workers in the facilities, you've got a big campus like a Presbyterian Homes, and they just went in and did the nursing homes, but they didn't do the assisted living or the memory care or the independent living. And all of those people are, all under one roof. And it just doesn't make sense. If they're coming in to give the shot, give it to everybody there, everybody that works there, and everybody that's living there, just like they're doing in the hospitals, they're doing everybody. It doesn't make sense when you're at a place where you've got people that are living 65 and older under one roof, and they're only picking out the nursing home people right now and not everybody else. It doesn't make any sense.
And we'll get updates saying, how COVID is in the facility. And it's, usually the staff that's bringing it in, it's not the residents that's getting it. So I just feel that I'm never going to get in to see my mom. Let's do something to help these people so that we can get in. So
I agree.
Thank you.
Thank you, Ms. Pap Richards from Bemidji. Next up, we have Barbara Heenan. Welcome, Barbara. And after Barbara, we have Kathy Wood-Hasseruth. So go ahead, Ms. Heenan, state your name and where you're from.
Good morning. Thank you, Madam Chairperson and members of the committee for this opportunity. And good morning. My name is Barb Heenan. I am a 67-year-old resident of Eden Prairie. I have my 92-year-old mother living with me. She probably takes better care of me than I do of her. She's very, very adept at what she does. She's a retired RN, and we're both having issues understanding why the Minnesota Department of Health is failing us so dramatically. There's been no communication. There are no phone numbers, as Dr. Scott Jensen mentioned. There's nothing on the news. Governor Walz's office was fully adequate in providing us updates on the virus. They even mentioned that the federal government was failing in coming to grips with how we might administer this and coming up with a plan. And at the same time, they were neglecting providing any type of a plan for their residents of Minnesota. I feel that at this point in time, if they don't have a solution, then they should step down and get out of the way. If they're more of an impediment at this point in time, in my opinion, than they are of any help to the residents of the state. It's a dismal failure, and I feel that they have blood on their hands as long as they have vaccines in storage and available to be administered, and just haven't come up with the plan as to who, how, and when to administer. Just like the federal government has blood on their hands with the riots in Washington, I feel the same way for the state officials and the Minnesota Department of Health. You are letting people die on a daily basis and become infected without getting this vaccine out. To have 30% of it out and yet 70% sitting on shelves is atrocious. It's something that needs to be fixed and needs to be fixed yesterday, not today or tomorrow. There's a dire urgency for this. I know you're all aware of that, and I appreciate you being our voice, bringing that forward to the Department of Health and to the state. I'm a cancer survivor. My mother has underlying conditions with lupus. Even though she is at the age she is, she says, I'm willing to die, I'm fine, but I just don't want to die of COVID. It's a horrid horrid death, and especially with the isolation that's involved with it. With that, I don't know what else to say other than I think there are logical solutions out there. We're able to get hundreds of thousands of people to the voting polls. Don't understand why schools aren't being used. Don't understand why community pharmacies aren't being used. There seem to be very logical steps of getting this to the community other than having the vaccination sit on shelves. That is just unconscionable. With that said, again, I appreciate your time and you bringing this forward to the state on our behalf.
Thank you so much, Ms. Heenan. Members, do you have any questions for Ms. Heenan? Thank you. Thank you very, very much. And I'm glad your mom's taking care of you. We have one more testifier, and then I'm going to open it up for discussion. Kathy Hasselrud, I think, is on the phone. Ms. Hasselrud, can you state your name and where you are right now?
Oh, can you hear me?
Yep, can hear you.
Okay, great. Okay, yeah, Kathy Hasselrud. I'm currently in Naples, Florida. I'm a long-term resident of St. Paul. I'm also a public health nurse and have been a public health nurse for 38 years. I'm coming on basically to talk and just really briefly about, I have been part of mass flu immunization clinics and in Minnesota. And I guess my understanding or my misunderstanding is I don't understand why we aren't using our public health clinics. There's 87 of them, to disperse the vaccine. Also, every Minnesota has a program called Minnesota Response, and that is full of nurses, paramedics, EMTs, physicians who are all volunteers to go to these mass vaccination clinics and give vaccinations. And I've been part of that. We also have Minnesota Visiting Nurses, which are the group that would do all the Cub stores, back in the days, and go to nursing homes and companies all over the state. So I just am not understanding why the state isn't using all these great resources to get these shots up. I'm in Florida. Florida, you can walk into the Publix grocery store and get your shot. And so I think that's a frustration that I was hearing from a lot of people is that, Florida is, there are issues with, waiting lines, but you can walk into the grocery store now and get your flu shot. And Minnesota, they're sitting on the shelves. And that concerns me because people need these shots. And I just don't know where the disconnect is because the distribution is out there. It's just not getting to, these groups that can do the shots, like the community pharmacies. So I'm confused where that breakdown has come from.
Thank you, Ms. Hasselrud, and enjoy your weather.
It's cold here today.
What, 50?
Yeah, I know. But it's just, and I understand the frustration because we have a 98-year-old in Presbyterian homes that really, wants to see people. And, we have the capability in Minnesota. We have volunteers. We have lines of communication. We have all, the Minnesota, let's say it's the Ramsey County Response, the medical reserves. And we have all these resources and they're just not being used.
Thank you, Ms. Hasselrud. And I've heard that too from our facilities like the Presbyterian homes or what have you. And they all have nurses on staff that are completely capable of giving the vaccine.
Right.
So it doesn't make any sense to them either. And that we've only used 35% of the vaccines that we have. Right. Waiting to get them. So,
and all the community, all the public health, the 87 public health clinics around that every county has, all are full of nurses. They have home care nurses that go into people's homes, and they know who can and cannot get out of their homes because they see them on a monthly basis. So there's, all these, we have these fabulous resources in Minnesota, and everyone's just sitting there going, use us, call me. I'll go do shots. I love to do shots. I'll be there, whenever you need me. And they're just, everybody's just kind of in the nursing. A lot of people, my nursing friends, they go, well, why aren't we? We'll give shots. We just tell us where to go.
Yeah.
So I'm hoping this gets moving because it's just frustrating for, because I'm in Florida and I'm seeing, signs everywhere. Go to Publix, go to the pharmacy. And yes, and I think somebody earlier said there are people coming, into Florida doing it. Most of the people here, like me from Minnesota, and there's actually right now no Canadians here. I don't know where they came up, but there's no Canadians in Florida right now because they can't get across the border. So, but anyway, I just think that there's, there's a demand. There's a people over here to do it. It's just somewhere in the middle, everything's clogged up.
Thank you, Ms. Hasser, for your testimony today.
Okay.
Thank you.
Okay.
I'm sure a lot of you have heard the same stories that I've heard, that people are getting in their cars and they're driving down to Florida. I was talking to a man yesterday. I'll just call him Bob from War Road. He said this is like Prohibition days with the vaccine. They have it at Thrifty White up there in War Road, but they distributed to the long-term care facility, just the nursing home part of it. But there were some leftover vaccines. There was like 10 of them. And so like we heard last week that they had to get rid of them quickly. So the Thrifty White called his friends and said, get on over here and you can get the first dose of the vaccine. And it was like mass rush to where they were at just to get it. But those that didn't get it are now mad at those that did get it. And those that got it feel like, they're the chosen one. But now that same Bob from War Road is on his way down to Arizona, because in Arizona, they have the list. And he was told on February 10th, he can get his second dose. Even being from Minnesota, he's on the list down in Arizona to get his second dose of the vaccine. So interesting that other states have that already set up where you can walk into the Publix and get it. And I think that's the part that's driving everybody so crazy is nobody knows. They just want an answer where to go to get me on the list. So that's what's frustrating. Members, you have in your packet a letter from AARP, and they too strongly urge the state to prioritize individuals who are receiving long-term care services and supports in their own homes and communities, just to make sure that it's a fair distribution process. And I think that's what people are feeling when they see that their local optometrist or their dentist office, the 32-year-old workers there are getting the vaccine, and yet they've been cooped up since March and not even on a list. So I'll open it up for discussion. I know Senator Rood, you wanted to make some comments.
Oh, thank you, Madam Chair, and good morning. I'm the senior member of this committee in more ways than one. And so I'm kind of living this whole scenario. I moved into an association community, so most of my neighbors we're of an age where we're not in the tier 1 because we're independently living, very, for the most part, healthy, the typical things you get when you age. And so in my association, I have several neighbors that, we have snowbirds that leave for the winter, and they are now leaving early because they, like you said, they have called down to Arizona and they can get their vaccinations. And so they are going to leave earlier than they normally would because they can go down and get the vaccination. And that's, extremely important for them. And last night I got a call from my neighbor, Doug, and I told him that I would share his story. And he went to the medical center, our local medical center. And we are blessed in our area to have phenomenal medical facilities, because I know I've shared with you many times that I have the highest median age of any county in the state of Minnesota. So we do a lot for our seniors. We have great medical care. But he went for his monthly checkup. He has underlying health issues. He has heart issues. So he goes once a month to the doctor. And when he was at the medical center, he engaged in a conversation with the nurse. And the quote was, "Oh, we have lots of unused vaccines at the medical center that are just not being used." And so he was really astonished. And that's when he picked up the phone and called me and said he just couldn't believe that we have this vaccine and we're not using it. So he went to the area in the medical center where they're giving the vaccines, where they're supposed to have technicians that give the vaccines, and there was no one there. There was no technicians there. There was no people receiving the vaccine. So we have the vaccine, but we're just not getting it. And so, when you're on the cusp of the, 69, 70, and you're under those, you're not first, that's fine. I don't, none of my neighbors mind not being first. They just want to know when they can get it because, we're very careful in our association, and we're very careful what we do, and social distancing. And so everyone's been very careful. They just want to go on living. And we want to be able to have our association get-togethers, after everyone goes golfing and get on with life. So I think it's, we have to get this distribution problem out there, and they're so frustrated because we know we have the vaccine and it just sits there and it's not being used. So thank you, Madam Chair.
Thank you, Senator Rude. Again, it's very frustrating knowing that the vaccine's sitting right over there in that freezer and you can't get your hands on it. And we did hear last week that the Department of Health has been told that they have to keep them on reserve, but I think that has since changed and they no longer have to keep them on reserve, yet we still are keeping them on reserve. And it doesn't make sense to any of those who want to get back into life as soon as possible and aren't able to. Senator Eakin.
Well, just one more point,
Yep.
Madam Chair, to that point. I think our medical professionals are doing a great job, but we have tied their hands. And so I just want to make that point that I don't put the blame on my medical centers or my pharmacies. We have tied their hands, and we need to untie their hands so that they can do the job. They're the professionals that know how to do this and who should get it. And we should let them do that. Thank you, Madam Chair.
Thank you, Senator Rude. I completely agree. Senator Eakin.
Thank you, Madam Chair. And very concerning testimony that we're hearing this morning. And I was just talking to somebody who's a former nurse, and they actually, I know that they wanted to help in distributing the vaccinations and give shots, and but was being told that he would have to go through, all of the training and stuff again in order to put in a certain number of hours, significant number of hours in order to get, I guess, recertified as a nurse in order to do that. That's another issue I think that really should be addressed during emergency situations like this. Sometimes we have to forego some of the requirements that we may have had, under different circumstances. And he was telling me, that he's fully capable of doing that, but he thinks this is a hurdle that is making it more difficult to get people necessary to administer the shots. I was wondering, I don't know if somebody is on from the Department of Health that could answer any questions. I had a question in regard to why there was testimony given that some of these vaccines were not being administered because they didn't have the second dose yet, and that they were waiting for the second dose to arrive. Is there some reason why you need to have a second dose already available? I mean, what kind of time period does that second dose have to be given in after the first dose is administered? I'm just wondering what the rationale is for not administering the first dose immediately, even if the second dose isn't already available. And I was also wondering if all the states in the country are getting, the same number of vaccines, doses of vaccines based on a per capita basis, or if there's any disparities there in terms of what states are getting how much of these vaccines.
Thank you, Senator Eakin. We don't have MDH on the call today. I don't know if Jillian Hendrickson has an answer to that question, but any of the questions we will forward on to MDH, because I was wondering that too. And I'm looking forward to the next vaccine call that MDH is, that they put on. They did that last one. I think it was last Wednesday. But I'm wondering the same thing. How many vaccines are each state getting? Is it their population and they do a percentage of the population, or how are they doing the distribution? I'm not sure. And I don't know if Scott Jensen is still on, if he knows the answer to that.
I can, if you want, I'm not on video, but the Pfizer biotech vaccine is 3 weeks in between shots, so 21 days. And the Moderna vaccine is 1 month apart. So it's just critical that if we're going to stick to the trial, which is what we should be doing, because as Dr. Jensen mentioned, the trials have been shortened to 1 year. I think it's probably smart to make sure that the vaccine is the appointment's rescheduled to come back, that the vaccine is there. Otherwise, it's not necessarily smart to get the first, because the first is less dose of the mRNA just to get your body used to it. And then the second dose is a higher percentage of it. So I don't know if that helps a little bit to clarify.
Thank you, Ms. Hendrickson.
Thank you.
And we'll get that other question to MDH, Senator Eakin. Senator Abler. Can't hear you. I don't know why, Senator Abler. It says you're not muted, but.
Anoka doesn't have broadband yet, Karen does, Madam Chair.
Let's see, Senator Abler. Can't hear you. And Senator Hoffman's having a jolly good time making fun of his buddy. No, we didn't have MDH on today, Senator Eakin, because we just wanted it to be a platform for the public to just tell their stories, being that there was 4,800 that did submit their public comment to the Vaccine Advisory Board. We thought we'd just let people get on video and tell their stories. I'm going to flip to Senator Curran ahead of you, Senator Abler, and you can test your audio in a little bit. Go ahead, Senator Curran.
Thank you, Madam Chair. While Senator Abler looks for one of the grandchildren to help him out on his technology needs, we'll move on. I think one of the things early on when the first testifiers and talking about the priority of senior citizens, anybody over 65, whether they be in a convalescent facility or otherwise, aging gracefully at home. The notion that we have only a portion of the vaccinations that are being distributed, or we're waiting for receipt of additional vaccinations in hand before we reassess priorities. I think the one thing that's been really clear, and I think we need to communicate this with MDH, none of them should be held back. And the one thing that's been consistent is the over 65 population has been the absolute greatest risk and consistent throughout the entire life cycle of this virus. And so I see no reason or excuse to treat everybody who's over 65 and critical care workers. I think we get confused because we've inserted this term in our dialogue of essential workers. We have critical workers in the healthcare environment that need this, and we would never argue that. But when it comes to the portion that's allocated to the over 65, there should be no reason that any of that changes. It is still the top way to stop the destruction of the virus in our elder population. And so I see no need when they come on board and we receive them, we should continue on that path to get as many of them vaccinated as possible. And I think we need a better answer from MDH on what are they using to continually reevaluate when we know where the greatest need has been since day one of the discovery of this virus in Minnesota. So thank you, Madam Chair.
Thank you, Senator Curran. Senator Abler, now we have you in 3D here from every angle. Such a pleasure.
Well, Madam Chair, the more of a Anoka anybody can see, the better, I think. And I appreciate the 14-year-old jokes, but I'm the only one listening in stereo. So I just want to point that out to people now. So anyway, Madam Chair, someday we're going to meet in person, and you'll just have one of me to contend with. And anyways, I appreciate the discussion, and I don't know if the department was invited today or if they're just busy, but I'm a little frustrated. I have to say I was really quite proud of the layout that they had, like 1A, 1B, 1C, and they had the dry run and the whatever, the FedEx Express truck got the cold box to where it was supposed to go, and like, oh, we're on top of this, and now it just seems like it's kind of clunky. And I was expecting to hear about how successful it's going, and where every last one is out where it's supposed to go, and so, Madam Chair, I don't know if you're as frustrated as I am, but in all these matters, you and I are reduced to the role of an observer on the COVID planning, on spending the $1.8 billion that came, and now on how we're going to administer what everybody's been waiting for as the answer. And so, I don't know, maybe they would want to call in and offer us some kind of a thought. And so I'm not trying to be a critic, but I'm just really frustrated. And I keep imploring the governor and other people to could you work with us? And so I'm sure that they're listening today, and maybe they're just as frustrated. I'd like to hear them say they're just as frustrated, and that the advice they've been given to me is that people are brought forward with a single number and could be useful. So, Madam Chair, I guess I'll just have you reply to that, since I don't have anybody else to ask right now.
Thank you, Senator Abler and Surround Sound. They probably are listening, and we'll have to ask those questions of them. It feels almost like bureaucracy is holding this vaccine distribution up. Everybody wants to make sure that they get it absolutely perfect, to make sure they don't make a mistake, but yet in the meantime, there the vaccines sit. And it really is on each state to decide to do it however they want to do it. And this is how Minnesota has decided to do it. Like some of the testifiers today said, in other states, they've chosen to do it a different way. And if the federal government says you got to have those on hold, they're not. They're just getting them into the arms of seniors. So, and again, it is, the Department of Health said this is at the direction of Governor Walz. So, and Senator Abler, like you said, it is frustrating because our hands are tied here too with no input. So that, again, is the reason for this committee, so the public can actually have a voice here at the Capitol. Senator Putnam, go ahead.
Thank you, Madam Chair. I just want to thank everyone for their testimony today. This is an incredibly difficult and challenging time. I lost my grandmother to COVID 2 weeks ago. Everyone's hurt by this in profound and different ways, and it's very compelling to hear these specific stories of people's specific experiences. I do want to follow up on what Senator Abler was just discussing, and that it seems to me, given the scope and the complexity of the problem, that we might want to disarticulate certain elements of it, because there's clearly a logistical problem, but there's also a communication problem. So perhaps we could, in addition to speaking with someone else from MBH about the actual process of rolling out the vaccine, also talk to someone about how to make communication around the rollout process a little bit more clear and useful.
Thank you, Senator Putnam. I completely agree on that. I think I think that is the frustration, is the communication. And like all the testifiers said today, they just want to know. And Senator Rood said, we don't have to be first. We don't care if we're not first. Just communicate with us. What is the rollout? Where are we at? When can I get in line? So it is a communication problem. And hopefully they can get that fixed. I did talk to the Department of Health last week and said, this is the number one thing that people want, is a place to go, a phone number, a website, something. And I don't know if any of you have been on the Department of Health's website. It's not the easiest to navigate. So you have the 84-year-old living at home and trying to get some answers. So they call their clinic. And I think Dr. Jensen said too that the clinics are being inundated by seniors calling saying, when can I get on the list? But it's not a friendly place to go, MDH's website, to try and get any information. And time is of the essence right now for these folks that have been locked up since March and getting so frustrated, they're getting their cars and they're driving to Florida. So I don't know if any members have any further comments on today's hearing. None. So that being so, we have Abler again. It's just distracting.
No, Madam Chair, I didn't, but I'm always happy to say hi again. So in stereo, it's so off, so seldom you get to be in two places at one time. Thank you, Madam Chair.
Honoring us with your presence twice. Anyway, so thank you guys, everybody, for showing up. This is an extremely important topic, and we will continue to push and continue to try and get answers. Our seniors are counting on us, those 65 and older, and even those, my friend's 64, and she can hardly wait to turn 65 so she can at least get on the 1B or the 1C. But our seniors are counting on us, and it is up to us to be their voice. And I think we've done that here today. We will continue to do it to hold MDH and Governor Walz accountable for this vaccination rollout and get answers to our seniors who are the most vulnerable and at risk for losing their lives to COVID. So thank you again. We will be having a committee hearing, I think, next week. I'm not sure. We're still hashing that out. But based on what's happening with the vaccine and the rollout, we'll decide if we're going to have another one next week, and I'll get those questions to MDH. Thank you so much. And with that, the Aging and Long-Term Care Committee is adjourned. Thank you,
Madam Chair.